Okay, for this first skill, I will be demonstrating thoracic mobility, so look at flexion, extension, side bending, and rotation, all with added overpressure, and we will assess. Good. Okay. Hi Mike, my name is Cody, I'm a physical therapist today. Okay, first we're just basically just going to look at how kind of your thoracic spine, kind of that middle of your back is moving, alright? Okay, so first all I'm going to have you do is I'm actually going to have you just wrap your hands right around your neck, right your neck, right around your neck, or we can relax the hands too. Okay, now we're just going to go and see the position. I just want you to bend down and over into that flex position as much as you can. Good, and come right back up. Nice and smooth. You do that a couple more times, alright? Good, and pause right, yep, go back down. Pause right there. Now, okay, I'm going to add a little bit of pressure here. I'm going to stabilize it here. No pain with that? Good, come back out nice and easy. Now we're going to do the same thing in that same position here in a second. Now the same thing, set up nice and tall for me. Yep, and then we're just going to arch back and try to look up at the ceiling, alright? That same thing. Yep, and come right back. Relax, go back up. Good, come back. Good, one more. Nice, and come back down. Okay, we're going to go right back up into that position. Bring those elbows a little closer for me. Right there, okay? Now all I'm going to do is I'm going to push up on those guys and stabilize right here. Ready? Good, relax. Come out of that. Nice. So for flexion and extension, what I'm seeing is maybe a little bit, you can see he's definitely moving from thoracic, not a whole lot of more flexion, which we might actually expect. But maybe nothing in abdominal limits with flexion. Extension though, he does seem to have some limit in thoracic extension especially, which is pretty common. As we can see, a little bit of rounded shoulder posture as well. And now, okay, we're gonna do our lateral flexion or our side bending. Okay, so for this one, I'm just gonna have you cross your arms right here. Boom, the first one, right, is this going to take my left shoulder down to my left hip, right? So I'm going to go here. Alright, we're going to do that same thing right back to the middle. Alright, let's go to your left side first. Boom, and then right back up. Any pain with that? No? Okay, give me a couple more, same exact thing. Boom, right back up. Good, one more. Awesome. Now we're going to come down. We're going to go into that in-range position right here. Come back to that side bend. Good, hold that. Give a little bit of overpressure. Good, come back up. A little stretch with that at all? No? Okay, now go same thing the other side, right? Same thing. Now go to your right side. Boom, back up. A little difference there. Back up. Go one more. Good. Any difference feeling side to side? No? Okay, so let's go back into that same position. I kind of stabilize here, give a little bit of overpressure to him. Good, make sure he's still safe on the table. Good. And right there, with the lateral flexion, I'm not seeing too much of any differences. I feel like maybe going to a little bit of the right, the contralateral side might be a little bit tighter, but nothing significant. And then the last one, all we're going to do is we go same arm cross position. Okay, we're going to sit up nice and tall. We're going to rotate all the way to your left as far as you can. All right. Yep. On you. Boom. Perfect. Come back. I'm going to do two more just like that. Boom. Good. Any pain with that? No pain?
No pain.
One more. Good. I'm going to go back into that position. I'm just going to stabilize right here. Give you a little bit of overpressure. Nice. Good. We'll go same thing to the other side. Good. Rotate completely. Good. One more. Good. Now we're going to go into that guy. Boom. We're getting a little bit of overpressure here. Nice. Again, all with the normal limits, even with rotation. I'd say he might even have a little bit of extra rotation, maybe like a hypermobile with rotation. More than we expect. Obviously, I'd have to measure that. But then, yeah, we will move on from here. Okay, for this next one, I'm going to squeeze in here for a second. We're going to look at the TMJ, like how the jaw is moving. And then, so we look at opening, closing, looking for C curves, S curves. And then lastly, we'll actually take a measurement of the range of motion of complete with his mouth completely open. Okay, we'll begin. Again, I might make a student physical therapist today. Okay. What we're going to do is basically we're just going to see how the jaw is moving, how everything's lining up, if there's any pain, any clicks, any pops, anything like that, all right? Okay, so the first thing I'm going to have you sit up nice and tall for me. Okay, now all we're going to do is we're going to go 5 times. Don't go too fast, right? I just want to think, open it up, close it. Okay, just going to go a few, like 5 repetitions right there. All right. Okay, ready?
Mm-hmm.
Open. Boom. Close. Good. Open. Close. One more. Nice. Okay. With that, I'm actually seeing a little bit of a C curve. I feel like on closing. Is there any clicking, any popping?
Yeah, a little bit.
A little bit?
Yeah.
Like when you're coming up, or when when you're closing your mouth, when you open your mouth?
Closing.
When you're closing it, right? So with that, there's a little bit of that C curve as he comes back up, closing the jaw. Okay, so this next one, all right. All we're gonna do is we're gonna take this guy. Okay, I'm not gonna completely do it on myself. Okay, is what we're gonna do is we're gonna line this guy up, basically right on the bottom of the teeth here. And have you open as wide as you can, expose those teeth, and I'm gonna from these bottom teeth to those top teeth. All right, that's basically how we're gonna measure it. Okay, so open up nice and wide for me for the teeth. Good. Good. And relax. So he's almost at 60 millimeters there, so that would actually indicate that he's actually hypermobile at the jaw, or TMJ. Okay, for this next skill, we'll be demonstrating CPA glides of T5, T6, and T7. And then, so I'll demonstrate on just one grade of, on one segment for all 4 grades of the, not manipulation, but for the mobilization, excuse me. Okay, so, hey Mike, basically what we're going to do today, okay, is I'm going to be looking at the mobility kind of your spine a little bit. Okay, so basically all I'm going to do is I'm going to kind of find this C7 up here, right there, and I can kind of count down from there. So, C7, T1, T2, T3, T4, and T. So as we know too, the thoracic starts to become less cervical, more lumbar as we get farther down. So as I find T5, which is right here, I can check on that mobility. I'm just going to give a little bit of pressure right on your back, all right? Is that okay? All right. Okay, so that same thing, I'm just going to kind of push straight down, kind of feeling for how that joint is moving. And not, I would say, at T5, nothing too alarming. I would say that maybe a little bit of stiffness, a little bit through that T5, which we kind of expected after we looked at his extension, so we actually might see that here. And then as I come down one more, so if I come down from T5 to T6, really I should find that spinous process and come a little bit superior to it as they start, the inclination starts to decrease on the thoracic spine. As I find T6, we'll do that same thing. We'll push straight down. And maybe a little bit of lack of motion here. Not too much. And then again, we'll find that last one. Then we'll find the spinous process T6, which should be on the vertebral body of T7. So now we'll be right here, that same thing. We'll push a little bit of that pressure down. Good. Again, a little bit of maybe some joint stiffness there, which again, we kind of saw with that observation of thoracic extension. So while we're here, okay, so I was kind of demonstrating that grade 1. I'm giving slight pressure down, kind of feeling that joint range of motion. Now if I go to a 2, just a slight more pressure. Again, we're not going to end range. But as I get to a 3 and a 4, right, we're really kind of pushing, trying to make a difference in that range of motion. Is that okay right there? Okay. Boom. And then a 4 would just be a little bit more. We're taking all the way down to end range as much as we can, coming back out, almost all the way out, coming all the way down to end range, coming right back out, and all the way back down, almost right all the way back out. What I'm going to be demonstrating is the volar and dorsal mobilization at the wrist joint, at the radial carpal joint. Okay, so Mike, for this next one, all we're going to do is basically looking at how the wrist is moving. Okay, so basically all we're going to do is I'm going to take your wrist here in a second. So like when you come up, that wrist almost slides down, and when you come down, when you flex down, that wrist almost comes up. Basically just looking at how the joints move. All right. Okay, so I'm going to take that and steal that hand from you. Okay, nice. Now just relax for me. There you go. Perfect. Okay, so like as we apply, we're going to start with this dorsal. As I apply dorsally, boom. He's also going to like push into flexion at the wrist as well. Okay, so as we go here, I'm kind of stabilizing just proximal to that. Boom. And then if we're going to demonstrate a grade 1, again, it's like slight pressure. We're just trying to get a little bit of synovial fluid and healing. 2 would just be a little bit farther. 3 would be, now we're coming into end range, and the same thing. 4, we're coming all the way to end range and back down. Any pain with that at all? Is that all right?
Mm-hmm.
Okay. Okay, so the same thing as we go volarly, or inferiorly, or as we push them almost into extension, as we push that, as we apply that volar force, boom, we can almost see that he's coming up into extension. Again, we're just we can oscillate these as a treatment. Kind of facilitating that movement at that joint. We're demonstrating a thoracic manipulation. Okay, Mike, so this last one we're going to do is called thoracic manipulation. Okay, again, it's kind of working, and I'm going to work on some of that thoracic extension, some of that mobility stuff that we found earlier, right? So with that, okay, it's going to be pretty quick, it's going to be pretty fast, okay? So I just don't want you to be surprised at all. Alright, so I'm going to have you roll over on your side, get as close as you can. Over here. Yep, perfect. We can cross those lines perfect for me. Good. I'm gonna go that pistol grip right where I want to be. I'm gonna do that skin lock. Okay, and then we're gonna roll them back as I hold that skin lock. Pull them right down onto my hand. And I'm gonna have them take a nice deep breath in, deep breath out, and as he exhales, boom, I'll apply that thrust just like that. Obviously, that was not the real thing, but yeah.